Alright guys, so today we're going to be talking about, is it okay to exercise with pain? Yes, in the short answer, exercising with pain is perfectly safe and often recommended to do so in the overall goal of decreasing pain over the long term, but also achieving some structural support around the area or the joint, whatever it is that might actually be sore at that particular time. With that comes the small caveat of it needs to come under some form of guidance and under a few little restrictions that most of the time your physio or an exercise physiologist can guide you through. Here at Inline, we like to follow this under essentially a three-stage process. In that, we call the first stage establishing a starting point. The starting point is the barrier to entry for everybody, where we want to find an exercise or a few things that you can do with a relatively low level of pain. That low level of pain might range from 0 to 3 out of 10 for the exercise or whatever it is that we would like you to do in the goal of developing some muscle strength and power around that joint, but also coordination of that joint or where the injury site is. The second stage is embracing the process, and the easiest way to think about that is that Rome wasn't built in a day, and neither is the rehab process. It's not going to go from 0 to 100 in a week, in 2 weeks. Usually these things happen over a longer period of time, and the rehab process can take that length of time, and if not more, in more cases than not. The last is managing expectations. This is the hardest part, where it's similar to the second stage, where along the way there's going to be a couple of steps forward and there's always going to be a step back here or there. And what we want to try and do as the physiotherapist with you is manage those expectations that some setbacks will come along. And what we want to do is always make sure that they're just that, only a setback, that you can take 10 to 15 steps forward, you take half a step back, and we keep on moving towards getting complete resolution of those symptoms and issues. So in summary, exercise, can't stress enough how important that is over the longevity of a rehabilitation journey to create meaningful change in not only your activities of daily living, but just your function in general. Thanks for tuning in, guys, and check out the blog related to this topic.